Well, good morning, everybody. Very good to be here. It's really nice to be in an audience like this that is really kind of exemplifies a lot of what we're talking about at the foundation now. I've heard the term cross-sectoral partnership, multi-sectoral partnership mentioned a lot this morning. And certainly the people in this room representing people who think that health is at the core of what they do, and others who recognize that though it seems like it might not be health that's at the core of what you do, it really relates to health, if it relates to the built environment, if it relates to building equity in our communities. And that's very much the kind of themes we've been thinking about in the Robert Wood Johnson Foundation, but also that many different community groups across the country are thinking about. I have had the opportunity to go coast to coast, corner to corner of the country the last year as we've been developing the strategy and refining it with groups like yours. And I'm just amazed at how much energy there is for thinking like this that across these sectors. So it's really great to be here today to continue that dialogue with you. So what I'm going to do today is give you an overview of what we're working on at the Robert Wood Johnson Foundation, building a culture of health. And I'll talk about that specifically, but I'm going to really focus for this presentation on the way we're thinking about measures. And I'll keep coming back to this over and over again. Measures that drive a movement, measures that drive action. So again, measures that are valid, but measures need to be actionable and meaningful. And what we're trying to do in the Robert Wood Johnson Foundation, and Stacy actually said this in her remarks, we are trying to catalyze a building of a culture of health in the entire United States. I think you used the term every nook and cranny. I think that's pretty much what we're trying to do. And use these measures and our funding and collaborations and partnerships like this one to build that movement. And it's a movement that absolutely requires collaboration across sectors, leverage of our foundation dollars, multiple partners working in this direction. Measures do require establishing a research and evidence base. So measures are really around meaningful action and internal validity. And we'll talk about both of those things. But you need both because measures have to engage the population. You know, I trained as an epidemiologist. I know how to generate measures that don't motivate people. Again, the art of what we're doing are measures that are valid and also meaningful and lead to actions and engage the specific sectors and people that we want to engage in those actions. That's what we're trying to do at the foundation. Sounds like that's what you're trying to do here. So I'll talk about how we're establishing a research and evidence base for that. I'll share with you some candidate measures. These are measures that are pretty close to what I think we're going to launch in the spring of 2015, but this is very fresh. This was just presented to our board last week in Cincinnati, so you're getting a chance to see some of these sample measures just a week after they did. They're very much in development, and during the lunch session, you'll help us refine those and see if they are matching the criteria I laid out, valid, meaningful, and linking to specific action. And then I'll end with talking about some of the expanded partnership opportunities I think are available to many of you through the direction that our funding is going. Since this culture of health is not just a measurement strategy that we believe can catalyze the nation, it is also an organizing principle for how we're aligning all of our funding at the foundation. All right, so what is this new RWJF strategy and how might it resonate with your work? Again, this is a vision to build a national movement to create a culture of health. Enables all members of our diverse society to lead healthier lives now and for generations to come. So again, you can see in the key points here of our vision statement, multiple sectors working together are key. Really focusing on well-being and health and not simply illness care is absolutely critical. We recognize that most people do want to make healthy choices, but we also recognize that the places where people live, work, and play do not provide equity in the ability to make those choices. So we really want to recognize all that and promote this model of building a culture of health. I've talked to a lot of groups, and I get some corrections about this point from people that say, is this an inclusive vision? What about people who have a chronic illness or disability? It's about being healthier, your maximum ability to be healthy where you are. What about the many cultures we have in this country that might find different pathways to well-being? Yes, this a culture of health plays out as many different cultures of health, and we can talk about that as we go through that. But we intend this as an inclusive vision, and we intend this as a vision that can resonate not just with policymakers or philanthropy, but with people who actually experience the kinds of health problems and disparities that we hope to work on. And we think this is actionable because there is so much of this activity going on. It would be extreme hubris if we thought we were inventing this anew. We're doing this because so many people like your group are doing these things right now. So we have been spending, I came to the foundation from Los Angeles in the middle of the winter last year, January 22nd, right after the Arctic vortex, or whatever they called it. It was a rude reintroduction back to the East Coast, but an exciting time for the foundation. And we've been working on trying to operationalize this vision. I mean, visions are great, but visions have to be also operational, measurable, and engage people. So we have been working intently over the last year at developing this strategic approach, operationalizing the culture of health vision, developing this national framework to describe what we think are the core components that, if they move in the right direction, will move the nation in this direction. Describing how this action framework, and we're going to talk about this at lunch, how this action framework will be applied and the measures that we're using. We're going to also recognize that national measures are good. I mean, how many people have seen Healthy People 2020 or any of the versions, right? But local measures are even better. How many people have seen our county health rankings, right? Those are the ones that really, and even at the neighborhood level, I know as a longtime public health practitioner, it's neighborhood level data that really catalyzes actions and gets people to engage and do things. So I'll talk a little bit later in the talk about how we're going to try to generate both some national measures that make sense, but also tie those to county health rankings, but also tie those to zip code and census tract measures that can be much more meaningful and engaging to populations. So as I mentioned, we're using these measures to align our foundation grant-making strategy across the foundation. And one of the neatest things, and probably what got me from California to the foundation, is the board has made a 20-year commitment to this building a social movement to build a culture of health, realizing that it's going to take about a generation's work to implement this kind of strategy with partners like yourself. So this is a long-term bet from the foundation. The board is very excited about this direction, reaffirmed that in the meeting last week, and it's just a very exciting and very different position for the foundation to be in. I'll just mention just a little bit. I don't want to talk too much about inside the foundation changes, but this is a foundation that was recognized for years as being very excellent. I think as a recognition from the board that to be excellent going forward, we had to change a little bit. One big sentinel indicator is this is a foundation that had two divisions, one on health care, one on health, that were a bit siloed, creative, innovative, but a bit siloed. Those divisions are gone. This is a foundation organized around the principles that I'm talking to you about today, and really trying to understand in a much more integrative way how we achieve this culture of health, and our grant making will be reflecting that. Culture of health, moving from vision to measures, okay? This is kind of one of the operational definitions that we're thinking about a culture of health. I won't read it all, but I'll just as you read it, again, a high value of health, not just illness care, high value of health shared across sectors, and about the capacity to promote individual and community well-being, and this goes back to the old World Health Organization definition that health is more than the absence of disease, recognizing that the physical, economic, and social environments have to prioritize health, and that there are strong equity issues to deal with because there are disparities in those conditions that promote health that must be dealt with if we're going to move as a nation in that direction. So this is the definition that we're working on about what a culture of health exists. I encourage you all to go on our website, rwjf.org. We have a culture of health blog, lots of other information that can go deeper into this. What you'll see on the website are these 10 principles of a culture of health. Our CEO, Dr. Risa Leviso-Murray, and our board came up with these about almost 2 years ago. This is the aspirational vision that has led to the measures we're going to talk about. And I'll just emphasize some of the ones that I bolded in the middle. Population health guides decision-making. Those of you on the healthcare side know that population medicine is increasingly something hospitals are thinking about because you are dinged for readmissions, and you need to think about what's the well-being of people who are discharged in the community. So population health is a science that needs to pervade what we're doing across sectors. All sectors working together. I'll be redundant about that, but that's why we're all here. You are recognizing, and it sounds like you've been working on this for a number of years, that you have to have multiple sectors working together. The health sector could not create or build a culture of health alone. And we're all in this together. This is my favorite one of Risa's 10 bullets, that unless we recognize that there is interdependency in health and we're all in this together, we will not get to a culture of health. And you'll see one of our 4 major measurement areas is trying to measure this dimension. It's the toughest one, and then one I appreciate your help as we talk about it at lunch. Okay, we're building on things that we've already been doing in the foundation around this, so it's not a complete jump from what we were doing in the past. Many of you, I think, know about the county health rankings and roadmaps. I think we have one of the communities represented here. We're building on that kind of work. We're building on our work of recognizing that part of a culture of health is strengthening our public health system, and the Public Health Accreditation Board work that's for the first time accrediting public health departments, which now has about 65% of the health departments of the country covered by accredited health departments. This is another major step that we're moving forward. We've had a commission supporting the foundation and understanding what are some of the big things we want to move to improve health. They focused a lot on implementing what we know about early brain development in early childhood services, so you'll see that a lot in our model. And then we're building on our partnership with Community Commons. That gets you that local zip code level data that's so important for communities to be activated. So we're building on existing data, but we're also going to, as I'll talk about, developing some new data. Okay, the research and evidence process, right? You do need to bring very creative research and evidence to metrics development. And we've done an extensive partnership with RAND Corporation because they have so many different disciplines, and frankly, because I'd worked with them before when I was in Los Angeles doing some work on building community resilience. They understood how to take a important but difficult concept like resilience to make it operational. They've been working with us on the same way with this culture of health. But we've involved a lot of different organizations to really understand what it means to do something like build a culture of health. A lot of that relates to community development. One of our major research partners on this one, I think your group knows this, is the Asset-Based Community Development Group at Northwestern, John McKnight's group, and those folks. That was the second grant that I did after RAND. And the measures I'm talking about and the framework I'm talking about is built on an extensive 30-year review that the Asset-Based Community Development Group did for us, so we could understand what have they learned that really have been driving effective community development and community organizations that sustain themselves through various funding cycles and flavors of the month in funding and continue to make an impact on building well-being in their communities. So we've got that as a really great evidence base. We've been in 13 cities around the country doing focus groups to just figure out what just regular folks who experience the problems we're trying to resolve think about these, and extensive outreach to all of our traditional stakeholders. I've presented this to Tom Frieden and the Centers for Disease Control, the NIH. Lots of resonance with this model in the traditional public health and healthcare community. We're finding, and I think you might find too, that some of the measures that we need to measure building a culture of health or building community well-being are not out there in the usual things that are measured nationally. So what we're trying to do, and just so you understand the measures that we're presenting here, we're trying to really measure the major drivers in a social determinants of health. And I know you've been talking about that. Root causes, what are behind the disparity rates in diabetes in African American and Latino populations compared to white. So we want to move deeper. Access to healthy food, exercise, precursor conditions, root causes. So we're looking at drivers, determinants, and root causes, not their disease endpoints in the measures that we're looking at. We're looking at measures that look at multiple levels. Remember I talked about measures for action, measures that motivate the kinds of actions that a policy making or even an individual decision making that are important in improving health and well-being. We're looking at measures that have to change, that need to change. I mean, when you're setting up a metric system, you don't want metrics that aren't that are just going to be static for 20 years. I don't think the board would let us get away with not having those measures change for the 20 years. So we need a mix of measures that are modifiable. We want measures that affect the entire lifespan, so we understand vulnerability in the early years of life and the later years of life, evolve over time. It looks really different what we're coming up with than Healthy People 2020, which is a great document, but not a document that's rooted in trying to actualize what social determinants of health mean and motivate people to act in ways that improve those. So measurement to drive a change process is the key to what we're talking about and what we're doing. Measures that catalyze a dialogue. I don't want to be the epidemiologist anymore that provides the data that no one understands. I want to be the epidemiologist that provides data that starts a dialogue about people thinking about what can improve health in collaborative and in new ways. We want to create measures that actually point out innovative activities that are already happening that improve community well-being, effective partnerships, and may involve unusual suspects. And we want, again, measures that connect with and drive deep community engagement, not measures that are just something that the statisticians look at. If there's any large goal that we have with this culture of health model, it's to change the default language, which is really a default language of illness care, to a default language of health in the way we think about health in this country. Really increase a common understanding of social determinants. All of us in research, we've been talking about this for years, but I think the fact that, and I'm going to up the percentage a bit from 40% to 80% of what are important health outcomes are really related to these social determinants. That's very well researched. If 80% of our health is related to non-illness care activities, what do we do to move that 80% in a way that we increase well-being? So mobilizing action at multiple levels, change how decisions are made. I'll talk more about that. We really want more sectors and more partners to understand that a corporation's decision on sick leave policies, on-site daycare is actually part of the wellness equation. And so we want a broader understanding about that and a broader accountability of the many different factors that many sectors influence that can drive health and well-being. So with that big buildup, I get to the model, and we'll have a time to talk about this at lunch. In philanthropy, they talk about logic models. We wanted to talk about an action model, a model that leads to action. And these are the 4 areas, and again, you'll talk about this at lunch, where we believe if we move in a positive direction in these 4 areas, at the bottom of this, we will improve population health and well-being. And I'll spend a little time talking about this as a setup to what you're going to talk about at lunch. So valuing health and social ties. This comes out of that we need to be all in this together part of the 10 principles. Big research literature on the importance of social network in health. Nick Christakis, a lot of other researchers have talked about that. You may have read the Bowling Alone book. All of that research speaks to the importance of social ties in health, particularly at a community level, and the importance of valuing health and not just illness care. So we have a cluster of measures and activities trying to promote that particular part of the model. The second one, fostering collaboration to build healthy partnerships. That's much of what you've been doing here. These are multi-sectoral partnerships, business, public health partnerships that develop innovative approaches to improving health and well-being and put different assets onto the table than just the healthcare sector. We'll talk about some of those measures. Improving equity in healthy communities and environments. This is a set of activities related to particularly the social determinants of health. The way to talk about it kind of negatively is a zip code should not be a negative determinant of your health. You know, where you live, work, and play should not be a negative determinant of health. What do you need to do in the physical, social environment to promote well-being so those inequities don't occur? That's in that area. And then re-envisioning health and healthcare, breaking down the silos and recognizing, as most of the countries that actually have their access and cost control problems in a better shape than us, they make major investments in the social side and preventive side of this health and healthcare continuum, and we need to learn about that. And Betsy Bradley at Yale has Yale School of Public Health has an excellent book where she's been documenting economically the cost that we pay for not having this kind of investment on the social side. So the theory is if we improve these areas, we will improve population health systems and well-being in the long run. So that's the action model, and what you have on your table, your little table tents are related to each one of these four areas. So I'm going to go through these kind of quickly with just some of the measures we're thinking about. Remember, we're looking at measures that get to root causes, have you think about maybe unusual drivers of health, not measures of disease, but measures of around what might need to change more societally. And I on this one. So valuing health and social ties. And any of the data that I have here, we've got validated measures either from existing data collection activities, or we will do it by national surveys that we are doing with RAND and their American Life panels. We're either collecting new valid data or we have it existing for each of those. And if people are interested in the particular citations for those, I can give them to you later. So we're working with a company I think you've heard of, Google, to do a number of different ways to try to track how people are thinking about health and healthcare, how they're thinking about prevention, how they're thinking about valuing health through their web search activities. So we'll have a couple of different measures with Google that help us understand through some big data analytics where the population is going in terms of some of their web searching around more of a focus on health. The American Health Value Segmentation Analysis. We're doing this with University of Chicago. How many people have heard about the somewhat pejorative classification soccer mom? Right? All right, that comes out of a form of a methodology called segmentation analysis. We're doing, I think, the first time for health, we're going to divide the nation into 5 ways of thinking about health that relates from, let's say, group 1 is even more convinced that a culture of health is something that should happen. That's group 1. Group 5 says, please get the government out of my Medicare. We want to understand the logic of each of those groups. We want the culture of health to reach each of those groups. So we are going to be doing some national survey work to understand how people are thinking about this and what can connect very different kinds of people to a larger common vision about health. So I won't go over all of these. We can talk about that at lunch. But we really want some measures that talk about sense of community and the fact of percentage of population who can rely on their neighbors or report adequate social support. That's actually a census measure that exists. That's an important idea that we want to kind of get into the mix. So we're kind of trying to come up with 30 or 35 measures that tell this story of building a culture of health. These are the sample ones for this particular dimension. Oh, civic engagement, that's important too. Today is November 4th. Okay, civic engagement is critical. On this fostering collaboration to build healthy partnerships, we're looking nationally at a number of indicators that really speak to these kind of collaborations. Health departments that collaborate with community organizations, health departments that have implemented community health improvement plans with partners like you. We've worked out this third bullet, a new measure with the American Hospital Association, where they are measuring through their annual survey to all the hospital CEOs, which they get an 85% response rate, the increasing prevalence of hospital community partnerships that go way beyond the minimal IRS requirements. So that'll be a new piece of data in there. Improving equity in healthy community environments. We want measures that speak to the importance of the physical environment. Housing is so key, so we're looking for the right kind of measure to lift up housing, access to healthy foods. Again, this might not be the final measure, but we need to have that in the equation. A couple of measures here are recognizing the early childhood. Why are we thinking about the prevalence of the full-day kindergarten? That's a new measure that CDC in its Community Guide to Preventive Services is now declared an evidence-based practice to improve child well-being. We like the measure because if you don't have full-day kindergarten, how do you get it? Well, it's a very local kind of thing, right? You have to go to your school district, and it involves the kind of citizen activism and local level change necessary to bring about full-day kindergarten, and gets people thinking about the relationship of education to health, which is really what we want to do with these measures. We can come back to talking about some of those later. In this Re-Envisioning Health and Healthcare part, here are some of the measures that we're looking at. These are a little bit more traditional. Percentage of the population with stable health insurance. We can get that from some of the data from the Affordable Care Act. Population served by an accredited public health department. That's kind of a quality measure. And we're still searching for the best mental health need measure. This is one that's kind of a stand-in now. It's really hard to find a national prevalence measure of unmet mental health need, but we're going to try to find something like that because mental health is so important to get into this. Consumer experience, part of what we need to do to build a culture of health is make sure that we have a higher quality consumer experience, and the CAP summary does that. And we're looking to motivate healthcare systems to be actively engaged with communities and community action plans that promote health. So the theory is if we move those 30 or so measures in over 20 years, you would be able to impact some of these longer-term population health outcomes. Some of the ones we have here that we're thinking about are a number of people who rate their health as good or excellent, scores on livability indices among seniors. The seniors feel that their neighborhoods are walkable, safe, access to health care for them easy. That's an interesting score. We're doing a lot of work with AARP on our seniors measures. We're trying to get a crime measure. This is sort of a stand-in for that. The chronic disease and disability adjusted life years is another good quality measure of essentially early treatment and control and prevention of chronic illness, and certainly a culture of health is going to drive down the $2.7 trillion in overall expenditures. So some of the percentage of healthcare spending and the shift of healthcare spending to the social side are some of the things that we'd be measuring in the national model. So this is, and I'll kind of talk over this. What you're seeing now is a stand-in for some of what you're going to see when we launch this website in the spring of 2015. This is just a data visualization. The whole point of these measures is to get the data from a national level to a local level using county health rankings or even to a neighborhood level. We're creating a website where your entry point, you might be interested in full day kindergarten, that you can get from that as a national measure down to whether that exists in your own school district through this website. And you can also get toolkits and action strategies that other communities have used, stories that talk about effective community action to improve health and well-being. And as you can see, as you're going through this data visualization, entry points into the website for hospital administrators, health professionals, teachers, community members, a very usable kind of website that will really connect with these national measures and really make it kind of more immediate in terms of what these situations look like in your own neighborhood. Coming to close now, National data isn't enough for us to figure this out, and I mentioned that we're going to try to get some local data on this, and so we're going to be selecting about 20 to 25 sentinel communities around the country. So these are not big place-based strategies where we're going to and comprehensively try to change things in those communities. They are a strategy where we're going to try to identify 20 or 25 communities that are in different stages of developing this kind of a culture of health framework. Some that may be extremely advanced in the kind of collaborations and focus on these activities that are real exemplars, some who might be in the middle, some, and then maybe a few that have serious issues and are beginning to organize but have confronted some barriers. We want to learn nationally what factors contribute to communities being able to develop these kinds of collaborations, what are the barriers, and essentially test our own assumptions about the action model that we presented. So we'll be selecting those over the next couple of months, and the data from the Sentinel communities will also be on that website. So looking ahead for partnership opportunities, we're going to be continuing the research stakeholder development. This is a good stakeholder engagement here. Great interest in continuing to link with the community development work and the work with the Federal Reserve, a great example of the kind of community partnerships we're looking at. I mentioned we'll continue to build this website. It'll be launched in next spring, next May. Again, we've aligned a lot of our grant making and programmatic development to support this culture of health concept and implement examples of it throughout the country. So let me end with that.